Hello everyone, I am Jan Quinji Enriquez, your student nurse from Davao Doctors College. And today I will be showing to you my written demonstration about basic life support. So BLS or basic life support refers to the type of care that the first responders, healthcare providers, and public safety professionals provide to anyone who is experiencing cardiac arrest, respiratory distress, or an obstructed airway. So first is, I will demonstrate the newborn CPR. We will evaluate the newborn's transition to extrauterinary life using the APGAR score. And then next is, check for responsiveness by tapping the shoulder, rubbing the soles, and calling out name loudly. So, hey baby, baby, wake up. Then next is, if there is no response, position the newborn on his back and call for help to activate the code blue or the doctor squeak, or we can also call 911 immediately. So code blue. Open the airway and suction if necessary. Then next is positive pressure ventilation or the PPV using the pediatric bag. Valve mask or BVM is initiated if apneic and bradycardic. Then next is attach BVM to oxygen cylinder with 100% oxygen. Then covers entire mouth and nose with BVM. So we'll just imagine that this is the BVM and we'll cover the nose and mouth. Next is allow 30 seconds of ventilation or 40 to 60 breaths per minute. Look for the chest rise with each bagging. Have someone attach a bradycardic monitor and pulse oximeter. Then just imagine that someone attached it. So here. Then next is do gentle chest compressions if heart rate is still below 60 after 30 seconds of PPV. So we will get our stethoscope and count the heart rate if it is below 60. So the heart rate is still 40. Use either 2 to 3 fingers or 2-thumb technique when doing compressions. Place compression fingers at the center of the chest below the nipple. Then press down approximately 1/3 the depth of the chest, about 1.5 inches. So do 1 to 30 compression. So you'll count 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. Observe 3:1 compression to ventilation ratio, completing the 4 cycles in 2-man rescuer. Then evaluate the heart rate after 4 cycles. If the heart rate is still below 60, continue chest compression and assist in intubation and giving meds. If heart rate is more than 100, proceed to do post-resuscitative care. Then next is, we will document the time, the procedure, the assessment, response to the treatment, and medication given. This is for database. Next is for the rescuer infant BLS skills. So first is check for response and for no breathing or only gasping. So at least 5 seconds but no more than 10 seconds. So we're going to tap the fetal part. So hey. Then send someone to activate emergency response system. If you cannot activate, yell for help. Help! You in black shirt, I need your help. The next is check for pulse, no more than 10 seconds. So check breathing and pulse. Assess if they are beating by putting our ears in their mouth and by watching their chest. Then next is give high quality CPR. Correct compression, finger placement. So if there is no pulse and there is no breathing, we're going to begin the CPR 30 chest compressions followed by 2 breaths. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. 1, 2. Then next is the position is 1/3 the depth of the chest, approximately 1 1/2 inches, 4 centimeter. Then rescuer CPR and switch. During 5th set of compressions, second rescuer arrives with bag mask device. Rescuer switch rows. So for the 2-man rescuer, the depth is at least 1/3 of chest, about 4 centimeter, and for the rate it is still 100 to 120 per minute. Both rescuers resume high quality CPR. Second rescuer gives 15 compressions in 9 seconds or less by using 2-thumb circling hands technique for 2 cycles. For the position just below the nipple line and the lower half of the breastbone, like this. And 2 hands encircling the baby's chest at the center of the chest below the nipple line. The ratio for the 2-man rescue is 15/2. So, 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15. Then, after 2 cycles, prompt rescuers to switch roles. Both rescuers resume high-quality CPR. So, first rescuer gives 15 compressions in 9 seconds or less by using 2-thumb encircling hands technique. Then, the second rescuer successfully delivers 2 breaths with bag mask. So, for the second rescuer, 1, 2. So, next is for the pediatric resuscitation. First is open airway and check for breathing for up to 10 seconds using the look, listen, and feel method. So, hello, can you hear me? Then, we can also clap and squeeze the earlobe and tickling the feet. Hello, can you hear me? Then next is, if not breathing, gives 2 rescue breaths. So 1 to 1/2 seconds each using the tube breath. 1, 2. Checks the victim for signs of circulation. We're then going to reassess breathing while simultaneously checking for a brachial pulse in this age. But we would check for a carotid pulse in any child over the age of 1, and this check is also for no more than 10 seconds. So for the infant, finds the correct position for compression by using the 2 fingers on the lower half of the breastbone just below the nipples, or encircles the infant's chest with both hands and spreading fingers around the thorax, and places both thumbs together over the lower half of the sternum. So 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 90, 91, 92, 93, 94, 95, 96, 97, 98, 99, 100. The next is compresses the chest quickly and repeatedly at a rate of at least 100 compressions per minute to 120 compressions in newborns. So, gives 5 cycles of chest compressions and 2 rescue breaths per cycle. 1, 2, 3, 4, 5, 6, 7, 8, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 26, 27, 28, 29, 30. 1, 2. For the child, puts one hand in correct position for chest compression. Place the heel of one hand, or if you're not sure if you're strong enough to compress hard with one hand, you can use 2 hands. So, give 30 chest compressions in 1 to 1/2 inch depth at a rate of 100 compressions per minute. So be sure to allow the chest to rise back after each compression, and don't forget to count. So 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. So, continuous 5 cycles of compressions and 2 rescue breaths per cycle. So, after 1, 2, 3, 29, 30. Put one, we'll give 2 rescue breaths. So to give rescue breaths, put one hand on the child's forehead, then put 2 fingers on the bony part of the child's chin, and 1, 2. So 2 rescue breaths. Then remember to lift your mouth slightly between each breath to allow the chest to relax. Give cycles of 30 compressions and 2 breaths over and over until the child wakes up or someone can take over you. So after 1 minute of CPR, pause and check the patient for signs of circulation. Then put patient in a recovery position and document the time and also the procedure started and the time of recovery. So next is for the adult CPR and AED skills. So assessment and activation. First is shout for help. Tap the victim's shoulder and shout. So, are you okay? Are you okay? And then, if the victim is unresponsive and you are alone, call for help and check for breathing. So, we'll check for breathing. We're putting our ears. And then, check pulse and breathing simultaneously. Open the victim's airway. Use the head tilts and chin lift technique. Press down on the forehead, one hand while pulling up on the chin with the other hand. So, next is activate emergency response system. So, stands for AED, high quality compressions. Place the victim in a supine or face-up position on a firm, flat surface. Kneel at the victim's side. Place one hand, kneel, and on top of the other and interlace your fingers. Place the heel of your hand in the center of the victim's chest on the lower half of the breastbone. Position your shoulders directly over your hands. Keep your arms straight and lock your elbow. Then, 30 compressions in no less than 15 and no more than 18 seconds. So, 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 25, 26, 27, 28, 29, 30. So next is compress at least 2 inches, 5 centimeters. Completes recoil after each compression. So for the adult breaths, gives 2 breaths with a barrier device. Each breath is given over 1 second and visible chest rise with each breath. So resumes compression in less than 10 seconds. Tilt the victim's head back and pinch the nose. Take a normal breath and flow into the victim's mouth. Watch for the chest to return to its normal position while taking another breath. 1. So next is for AED. So AED is short for automatic external defibrillator. So it analyzes the victim's heart rhythm. First is we'll power the AED here. So we'll just imagine that it is an AED. And next is correctly attaches pads in the chest and clears for analysis. So everybody's clear, and then clears to safely deliver a shock. So we will now give a shock in 3, 2, 1, clear. Then next is safely delivers a shock. Switches rows every 2 minutes or after every 5 cycles. So 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 18, 19, 20, 21, 22, 23, 26, 27, 28, 29, 30. The next is practices good team dynamics. Teamwork is needed here. So now the patient is now revived. So emergencies can happen anywhere. So it is important to know how to provide basic life support care. And thank you for watching.